In the Philippines, the flow of the blood bank system involves a series of coordinated steps to ensure a steady and safe supply of blood for patients in need. It begins with voluntary blood donations by individuals at donation drives or centers. Donated blood undergoes rigorous screening for infections before being processed into different components like red blood cells, plasma, and platelets. These components are stored under specific conditions until requested by hospitals or medical facilities. When a patient requires a blood transfusion, the hospital submits a request to the blood bank for the needed components. Upon confirmation of availability, the blood components are delivered to the hospital and transfused to the patient. Throughout this process, strict quality control measures are in place to maintain the safety and effectiveness of the blood supply. Additionally, donor recruitment efforts and educational programs are conducted to ensure a continuous supply of blood and raise awareness about the importance of blood donation in the community. This is an example of a one-story floor plan of the blood bank department. Our waiting room here. This is made to be convenient and comfortable for you. We value your time and try to make your visit as pleasant as possible, whether you are here to donate or receive blood products. You can view television and read educational materials containing risk and benefits of blood donation. Over here is our donor counseling room. This is where the donors will be interviewed and counseled regarding the donation process. Donor counseling is essential during blood donation to minimize the loss of suitable donors whilst maximizing the retention of donors, including those who are temporarily deferred. The physical examination area enables us to observe the potential donor for signs of extreme anxiety, drug or alcohol influence, or uneasiness. These observations should be made gently so as not to discourage the donor from making further donations. Potential donors should be in good health, show no signs of drug use, and have no obvious skin lesions. This section of the laboratory is intended to utilize various processes to prevent blood-borne pathogens from being transmitted through infected blood products. Several additional steps are necessary to gather donated blood, primarily to safeguard the patient well-being and also to reduce the risk of external contamination. The premise is sufficient in size for efficient operations, with separate areas for clean and dirty processes, clean running water, and surfaces cleanable by disinfectants. Collection area is separated from areas to minimize the risk of respiratory pathogens for workers. Apart from whole blood extraction, there are various processes for isolating specific components from blood such as plasma separation, red blood cell isolation, platelet isolation, and leukapheresis for white blood cells. Additionally, there are techniques like centrifugation, filtration, and immunomagnetic separation used in blood processing and analysis. Apheresis is a process that involves removing blood from a donor or patient, separating specific components like platelets, plasma, or white blood cells, and returning the remaining blood components back to the donor or the patient. This separation is typically done using centrifugation or filtration techniques. It's commonly used in therapeutic procedures such as collecting platelets from donors for transfusion or removing excess antibodies in autoimmune disorders. A closed collection system with a sterile blood collection bag containing anticoagulant and with an integrally attached tube and needle are being utilized. Some bags include diversion pouches to sequester the first 20 ml of blood collected to minimize the contamination from normal skin flora. In collecting blood, it is important for the medical practitioner to critically identify the donor and write labels and blood collection bag of the correct type. Ensure that the information in the labels matches with the donor's information. Select the appropriate vein and disinfect the site of venipuncture with proper disinfectants. In general, a 16-gauge needle is used for the collection. Closely monitor the donor and the site of puncture. About 30 seconds during the donation, mix the collected blood. After, remove the needle and collect the samples. The provision of a sink for hand washing in a blood bank facility in the Philippines involves ensuring that there is a designated area with a sink, soap, and water for individuals to wash their hands thoroughly before handling blood or blood products. This measure is crucial for maintaining aseptic conditions, preventing the spread of infections, and ensuring the safety of both donors and recipients of blood products. Additionally, it aligns with the international standards for blood safety and quality management. This section employs the techniques to screen for transfusion transmissible infections, safeguarding every drop of donated blood. At the very heart of these operations lies the meticulous process of blood typing and cross matching. Here, trained medical personnel meticulously analyze the blood samples to determine their type and compatibility with potential recipients. The initial and the most crucial step of this process is the correct identification of the patient, which includes the preparation of the test requisition. The test requisition includes the patient's full name, unique identification, and requested tests. The blood samples used for the patient testing may be anticoagulated in EDTA or clotted from a non-anticoagulated sample, depending on local policy. For testing, a non-hemolyzed blood sample is needed. Samples must be labeled in the presence of the patient at the time of collection. Standards also require documentation of the date and time of sample collection, as well as the identity of the phlebotomist. Pre-transfusion test includes ABO and RH typing of the patient's red blood cells and an antibody screen with the patient's plasma. All blood units collected for transfusion must test negative for the following: hepatitis B, syphilis, malaria, HIV 1 and 2, and hepatitis C. Every donated blood unit found to be initially reactive to any of the 5 TTIs mentioned shall be retested twice. ABO typing includes examining the patient's red blood cells to detect A and B antigens using anti-A and anti-B antisera. Additionally, the patient's plasma is tested for the presence of anti-A and anti-B using type A and type B red blood cells. It is essential that the results of the forward grouping align with those of the reverse grouping to validate the patient's ABO type. RHD typing checks for the RHD antigen in the patient's red blood cells using anti-D sera. Rhd negative individuals might produce antibodies if exposed to Rh positive cells, so Rh negative blood is recommended for them. Rh negative females, including children and women capable of childbearing, should avoid Rh positive blood to prevent potential HDFN risks in future pregnancies. Antibodies to non-ABO antigens may develop in anyone who has been exposed to red blood cell antigens different from their own through pregnancy or transfusion. To detect these antibodies, a sample of the patient's plasma is tested against selected commercial type O red blood cells that express the majority of clinically significant antigens. For infants under 4 months of age, the screen may be performed on either infant plasma or maternal plasma. Cross-matching is a method of confirming compatibility between the patient and the donor and is the final step in procuring red cell units suitable for transfusion. Electronic cross-matches are only performed when the patient's current antibody screen is negative and there is no history of a clinically significant antibody.
Processing of blood into blood components storage facility. This section in the laboratory aims to provide quality blood components to patients and ensure proper storage of every blood components. Components can be derived from whole blood or apheresis. These are the instruments involved in processing blood components. First, you have your centrifuges, which are used in separating blood components according to the spin condition recommended by the AAB. You have your plasma expressors, which apply pressure to the blood bag, allowing the components to flow from one bag to another by an integrated tubing system. An example of an automated expressor is called the Compomat G5 or Fenwal. Next, you also have your scales, which are used in order to ensure proper measurement of volume of every blood component. You also have your tubing sealers, which are used to melt and seal the PVC tubing by using targeted radio frequency energy and pressure. You also have sterile connection devices, which allow two separate blood bags to be connected via their PVC tubing without breaching the integrity of either container. Plasma freezer is used to freeze the liquid plasma in the standard negative 18 degrees Celsius or colder temperature until solid. For your storage devices, these include your freezers, refrigerators, and platelet agitators. For your platelet agitators, these are used to prevent aggregation and facilitate gas exchange. Storage facility. It plays an important role in the healthcare ecosystem. It serves as the lifeblood in medical emergencies, surgeries, and treatments. In storing blood components, it is very critical to maintain optimal conditions to ensure blood integrity. Expiration management is also a factor, as it is important that expiration dates must be meticulously tracked to prevent wastage. This is achieved through regular quality checks. Regulatory compliance in blood storage involves meticulous attention to detail and adherence to guidelines. Release of blood products. This section is important to ensure safe and efficient release of blood products to patients and to avoid any transfusion reactions. Retrieving blood products. Trained staff members retrieve the requested blood products from the inventory storage area. Proper identification and labeling of each product are crucial to ensure traceability and prevent errors. Verification and inspection. Before releasing any blood product, thorough verification and inspection are conducted to confirm that it meets all quality and safety standards. Documentation and record keeping. All steps in the releasing process are meticulously documented, including details of order, product retrieval, verification, and inspection. Release of products. Once all checks have been completed satisfactorily, the approved blood products are released for transport to the requesting healthcare facility. Proper packaging and handling procedures are followed to maintain product integrity during transit. Administrative Office. It is a designated section within the blood bank facility where authorized staff verify recipient identities, confirm requested blood products, and complete the necessary paperwork for blood release.